Hi, my name is Andrea and I'm a student nurse.
Hi, I'm Christa.
It's good to meet you.
You too.
Can you please give me an SPAR report on your patient?
Of course. Okay, so my patient is in room 622. His name is Ronald Jarvis. He is 67 years old. He is a male and he does not have any known allergies. He's a full code and he was admitted by K. Phillips, MD, and he is 171 pounds. His admit date was Tuesday at 1600. He was actually brought in for a primary diagnosis of a stage 2 diabetic ulcer on the right heel. His secondary diagnosis is diabetes mellitus type 1. His history is an increased blood glucose for the past 5 days, and his results are consistent in the 300s. He has a non-healing wound on the right heel, and he's actually had diabetes for 20 years, and he's been taking insulin. He did have some pain, but it's only a 1 after morphine, and he does not have any changes in thought or behavior. But he does admit to tingling in bilateral lower extremities, which have worsened in the past 3 months. He doesn't feel a pinprick deficit in the bilateral lower extremities as well. But he does ambulate independently. He's alert and oriented ×4. He has a positive perla. He denies a cough or any dyspnea, and his lungs are cleared of auscultation in all lobes. His breathing is unlabored and without accessory muscle use. And his S1 and S2 heart sounds are appreciated without a murmur, a rub, or a gallop. He has regular rate and rhythm and no carotid bruit. And he did want some information on his diet because he's on a 1800 American Diabetic Associated diet. So as for his abdomen, it's flat, symmetrical, soft, and there's no tenderness. His bowel sounds are present in ×4 quadrants, and there's no ascites and no bruits. He denies any flake pain, dyspnea, problems with urination. So he was brought in for his stage 2 diabetic ulcer 3 weeks ago. It's 5.5 centimeters by 2.5 centimeters and 3 centimeters deep. The wound base is pink and there's no tunneling or undermining. There's moderate serosanguinous exudate, and he did try soaking it in saline water, but it did not help him. And he has been ordered a normal saline rinse with dry sterile wound dressing for that. So for his labs, his hematocrit is 41.2, and his white blood cells are okay at 5,000. And he has a high blood glucose on Tuesday at 600, at 310, and his potassium is 3.8. And I'm recommending that we run a new A1C because it was taken 3 months ago, but at 5.2%, but his blood glucose has gone up a lot since then. And his albumin is 4.2. He does have an IV on the right median forearm in the vein, and it's peripheral. The meds that he's on is simvastatin, gabapentin, regular insulin, and regular insulin with a sliding scale, and morphine as needed. And he did have an AccuCheck at 2030, which is 242. And his vitals are 76 for heart rate, respiration 16, and 96% O2 sat, and his blood pressure is 128/70.
Thanks.
Yeah.
What medication are you going to be giving to the patient today?
I'm going to be giving him insulin, Lantus.
And why specifically is this patient receiving this medication?
Well, he is receiving this because he has diabetes mellitus type 1, and his body can't actually manufacture his own insulin, so he needs to get it from an external source to help facilitate it into the cells and help potassium and amino acids go in.
What specific action does this medication have on his body?
Well, it's going to lower his blood glucose, so you're going to want to make sure to pay attention to his glucose levels and make sure he's not hypoglycemic before giving it to him.
When should you question administering this medication?
If he is hypoglycemic, because it could drop him even further.
Does this medication have a therapeutic serum level, and what vital signs do you need to monitor?
You'll want to monitor all of his vital signs, but specifically blood glucose, because you, again, don't want to send him into hypoglycemia.
Which physiological parameters should you monitor when you're getting this medication?
You're going to want to make sure that he's not experiencing any signs with hypoglycemia, like sweating or tingling lips. So you want to make sure he's paying attention to all of that. And you'll want to make sure he doesn't have any allergies to it or hypersensitivities.
What interventions must be taught to a patient in order to ensure that the medication is administered safely in the hospital?
You'll want to tell him to make sure he's using clean materials, always washing your hands, always using gloves, always using a scoop method to make sure you don't poke yourself. And a really important thing to reduce irritation is to rotate your sites. Use the upper arm, the abdomen, and the upper thigh. And just to always watch out and check your blood glucose level and to watch out for the signs of hypoglycemia.
What interventions must be taught to him in order for him to take his medication safely when he's at home?
When he's at home, he's going to want to do the same thing, always check his blood glucose level, and make sure that he is always watching out for hypoglycemic reactions, such as tingling lips, and make sure that you administer it in the right places and that you rotate.
What are the side effects or the potential adverse reactions of this drug?
The most severe one would be anaphylactic shock, so you're going to want to watch out for that, and you could get irritation, and again, you could get hypoglycemia.
How will you know if this medication has been effective?
If you check his blood glucose and it's within normal levels. Okay, let's go ahead and administer it. I'm going to roll my cart over here. Hi, I'm Christa. I'm going to be your nurse today.
Hey, how you doing?
I'm good. How are you?
Good.
Do you mind if I have a level 1 nursing student come in and watch as I give you your insulin?
Yeah, that's fine.
Okay. I'm just going to wash my hands. It's an important step. Make sure you always do this to reduce infections in the hospital. So how are you doing today?
I'm doing mighty fine, thank you.
So did you have any questions about your insulin?
I don't think so. I was wondering about my diabetic diet, though.
Okay, I'll talk to you at the end about that then.
Okay.
Okay. So let me just check your chart. Okay. Could you tell me your name?
My name's Ronald Jarvis.
Okay, and could you tell me your age?
It's 67 years old.
And do you have any allergies?
No allergies.
Okay. I'm just going to get the scanner. Check you. Make sure. Okay. And are you having any pain today?
No. Okay.
Okay. So I checked your blood glucose and it's 242. So I'm going to give you your insulin Lantus, okay?
Sounds good.
Okay. So are you aware that you're supposed to be alternating your injection sites at home?
Yes.
Okay, what sites do you use?
I usually do my abdomen and my back of my arms.
Okay. And another site you could use, which would help to reduce irritation, would be your upper thigh.
My
So
thighs?
just, yeah, if you rotate between all of those, it'll just help you to not get irritated.
Okay.
Okay. So I'm comparing the MAR to the doctor's order. Sure, it's right. Okay. All right. So now I'm gonna wash my hands again. Touch the dirty computer.
Gloves seem a little flimsy.
Yeah. But you know, if they break, you're always going to want to get a new pair.
Yep.
actually going to get a different size.
Nurse Christa, I have a box of gloves right there on my table, the blue ones, and those ones are sturdier if you'd like to use those. To your left.
Okay, thank you. Always prepared.
That looks better.
Yeah, there you go. Okay. I'm going to get your medication. Okay. Make sure it's not expired. Now let's see. So it's the right medication. Check it against the order. It's the right dose. And the right person. Could you say your name again?
Ronald Jarvis.
Okay. And the right route. Okay. So I can get my needle out. So before I administer it, I'm going to take it one more time. Make sure it's the right medication, right dose, right route, right person, and make sure it's clear. It's not expired. And could you say your name again?
Ronald Jarvis.
Thank you. Okay. Get some alcohol. The order is for 18 units. Okay, so now you check the medication one more time by scanning it. And you check all of it again, the right route, the right dose, the right time. Okay. Now let me scan your bracelet.
Oh, here it is.
Thank you. Okay. So do you have a preferred site of where I do the injection?
I like it in my abdomen, right by, right in the tummy.
Okay. And you put the lock on it. Put it here. My hands. So do you have any questions about administering this at home?
Now you explained to me about the rotation of the sites. So I think you're well informed on that.
All right. Well, you had some questions about your diabetic diet, right?
Oh yeah, my diet too.
Okay, so, well, you're just going to want to make sure that you're not eating high sugary foods, obviously. And you want to eat 3 well-balanced meals a day. And you want to space them about 4 to 5 hours apart, and you can have a small snack at night.
Okay.
But you'll want to increase your fiber intake to about 3 grams.
Okay. And where could I get my fiber from?
He would get it from fruits, and actually it would be better to eat whole fruits than fruit juices because those have a lot of sugar in them.
Oh, okay. That's a good idea.
Okay, any other questions?
No, I think that's it.
Okay. Well, I'll be back in about 15 minutes to check on you to make sure that you're feeling all right.
Okay, thank you.
You're welcome. And I'll lower your bed, give you your call light, make sure everything's within reach. Scoot out. Now I'll document all the teaching that was done and anything else that happened in the room.
Were there any pertinent pieces of information that you reviewed before administering the patient his medication?
Yeah, I reviewed all his vital signs, but most importantly, his blood glucose.
Did this information affect your decision to administer the medication?
Yes, because if it was too low, I would hold the insulin because it could drop him into hypoglycemia.
And did this information affect how you gave the medication?
No, it didn't, because if he was actually hypoglycemic, I would have held it. But since he did have a high blood glucose, I wanted to make sure I gave him his insulin so that it corrected it. But if it was a sliding scale, I would look at the numbers and compare it to decide how much I would give him. But in this case, I just had to give him 18 units to correct it. Now I'll document my teaching and make sure all that's done. You have any other questions?
No, thank you.
Okay, you're welcome.